My pathological disease is cystic fibrosis, and cystic fibrosis is an uncommon disorder that someone gets by inheriting 2 copies of the defective gene. So for this to happen, both parents need to carry 1 copy of the defective gene, and people who only carry 1 copy are called carriers. And cystic fibrosis affects mostly the respiratory and digestive system. And according to Mayo Clinic, cystic fibrosis affects the produce of mucus, sweat, and digestive genes. So most people secrete thin, slippery fluid, but people with cystic fibrosis secrete a thick, sticky mucus that then clogs tubes, ducts, and passageways. So this is especially bad in the lungs and in the pancreas, and this affects the pancreas according to the Cystic Fibrosis Foundation, because when people with cystic fibrosis eat, the pancreas does not produce enough insulin, which would cause cystic fibrosis-related diabetes. Also, thick, sticky mucus blocks ducts in the pancreas, and that will then prevent enzymes from reaching into the small intestine, which helps to digest food. So this can cause pain, cramping, gas, loose, greasy stool, or constipation and blockage. Cystic fibrosis affects the lungs according to Cystic Fibrosis Trust. Is the sticky mucus clogs the lungs and creates the perfect environment for bacteria to grow. So since there is bacteria growing in the lungs, that then can cause lung infections and all that fun stuff. So people may also have restricted lung functions due to the thickening of the airways and the narrowing of the lumens, which that damages the airways and the obstruction of the airways with mucus. So, which then can cause breathing complications. So, and another interesting thing about cystic fibrosis is if someone else has cystic fibrosis, they're actually not supposed to come within at least 6 feet apart of each other, because they could possibly have a different bacteria in their lungs, and if someone with cystic fibrosis gives it to someone else with cystic fibrosis, that could then be life-threatening. People with cystic fibrosis may also have asthma, aspiration, and allergies. They can also have complications such as collapsed lobe or pneumothoracic. According to the Lung Association, the symptoms of cystic fibrosis is coughing, reoccurring chest colds, wheezing, shortness of breath, frequent sinus infections, and salty tasting skin, because that messes with your sweat. Cystic fibrosis is usually caught at birth by screenings and genetic testing, but I worked with a girl and she actually did not get diagnosed with cystic fibrosis until she was like 32, and for years they thought that she just had really weak lungs and she got pneumonia all the time, so she just thought that she had a weak immune system, and I thought that was super interesting. And for treatments, according to the Mayo Clinic, that there is no cure for cystic fibrosis, but there are treatments to ease the symptoms. So there are medications that target the gene mutations and to treat the lung infections, and the mucus thinning drug, which helps thin that nasty thick mucus that get caught up in your lungs. And then there are also medications to help with the pancreas enzymes, so you can get your digestive system working back to normal. And there are also vest therapies, and with the vest therapies, you can put it on and it'll vibrate your chest really fast, So you are then able to cough up all that stuff that is stuck into your lungs. And there are also surgery options, but usually you get surgery depending on how bad your cystic fibrosis is, and those surgeries are nasal and sinus surgery, non-invasive ventilation, feeding tube, and bowel surgery, which there is also a liver and lung transplant, but most people with cystic fibrosis don't really get the chance to get that because it's such a hard surgery trying to find someone with a matching lung, and most of the time they don't live that long anyway. But that is all that I have for cystic fibrosis, and I hope you guys enjoyed watching. Thanks.